How many of you guys have ever needed to give CPR to save a life? I personally have never had to administer CPR to save a life, but knowing that I have this skill and knowing that I am certified through some of the classes I've taken just makes me feel a lot more comfortable, especially when it comes to saving a life. So today I'm just going to be running you through the simple basics on how to give CPR. So this is my little visual aid that I'm going to be using. First, you're going to want to check the scene for safety. This is kind of something we do off our instincts already as humans. We analyze the scene in our heads. We don't really have to remind ourselves that that's something we have to do, but sometimes adrenaline can kick in and you do need to check the scene for other things that can pose a risk to safety, including your safety. After that, you're going to want to go into the shout, tap, shout method, and this is just checking to see if the person is responsive or not. You're just going to shout at them like, hey, tap their shoulder. That wasn't shouting. Be like, hey, tap their shoulder. Don't like slap their head or shake them. Just do a tap on the shoulder and then shout again. And you just want to do this like once or twice. If they're not responsive, you'll be able to tell, and once they're not responsive, this is when you would be calling 911. If you have to call them yourself, dial it, put it on speaker, set it next to the person so that you can start giving CPR and you don't have to worry, because you can't give CPR with one hand. That doesn't work. If there's other people around, it's best if you can yell like, someone call 911, so that someone else can call CPR and maybe walk you through it if you don't know how to do it, or just so someone else has a little more control of the situation and it's not just all on you, because that can make someone super anxious and it's just not good for that. So it's best to just yell for someone. After that, when you start to think about administering CPR, you need to make sure the person, this is my little visual aid, is on a firm flat surface. You're not going to want them slanted like this or slanted like that, or on rocks or something that could pose another safety hazard to them. And you certainly don't want them on a bed or anything, because a bed is obviously bouncy like that. You can bounce on a bed, and their body, when you give the CPR, is just going to be bouncing up and down, and you need to get deep into their chest to really make sure the CPR works. Starting CPR, again, firm flat surface, you're going to want to put 2 hands on their chest in between their nipples and right in the middle of their chest. So my stuffed animal, it's a random guess, but you're going to have your one hand down like this, and then you want to wrap your fingers around that hand, keeping these fingers of the first hand off of the chest. You don't want to be like that. It's not happening like that. You want your palm in the spot that it needs to be given. And I obviously can't do it to myself, but on my stuffed animal you can see the palm going in, and you have to go deep. It's not just a soft little, you're going to hurt them, you're going to break ribs, but at the end of the day, would you rather have broken ribs or would you rather survive? I think I'd rather survive with some broken ribs, so that's fine with me. And then you're going to start giving compressions. Now there's a bunch of different songs that you can give compressions to the beat of. It's normally 100 to 120. You can count if you want, or if you know the songs by heart, you can play them in your head and imagine the beat. So my favorite song to do it to is Staying Alive, because the name kind of makes sense to me. And you're just gonna want to make sure your elbows are locked, giving the deep compression. So I'm gonna play a little bit of the song for you guys. It'd be like that. I know you can give it to Pink Pony Club, which maybe people are more familiar with, and I think Dancing Queen is also one of them now. And then after that, you can give breaths, and breaths are not mandatory. There's actually some studies that have shown that CPR is more effective without the breaths, because it stops, if you don't know how to give the breaths effectively, it stops from focusing on the chest, and it's just the head tilt, chin lift, and you want to open their mouth and you blow air into their mouth until you can see their chest rise. So when you blow air, it'd be like their chest would rise up, and that'd just be pushing air into their lungs. But if you don't know how to give that properly, it's best to just stick to the normal way of CPR, because that means you're pumping their heart and bringing it back. So again, that's not necessary. And then you just want to continue this for 30 sets of chest compressions with 2 breaths, or just continue on the chest compressions. You are going to get tired. It's not easy to give someone CPR. Your body's going to want to give out. I've personally done CPR on the test dummies, and it does get super tiring. You're on your knees. You're just pushing and pushing and pushing. You will get tired, but you have to remember that you're saving someone's life at the end of the day, so it'll be worth it in the end. So yeah, that was my tutorial on how to give CPR. And a little fun fact, there is a law called the Good Samaritan Law, which you cannot get in trouble for helping someone that needed, for example, CPR or help at the scene of an emergency, because you're just trying to be a good Samaritan. So that's something to keep in mind, because a lot of people probably don't want to interfere with that kind of thing because it involves someone's life. But as long as you put your best effort forward to save them, the Good Samaritan Law comes into effect. So I hope that taught you guys a little something, and maybe you can keep it in mind if you ever have to give CPR.